Hello fellow Australian GPs. Thank you for your interest in the exciting new field of medicinal cannabis. Currently there are 1 million regular users of cannabis in Australia, and about half of them are medicinal users. If we look at regular daily use, there's about 400,000 Australian daily users of cannabis, and about 200,000 of those are medicinal. Thank you to the Royal Australian College of GPs for having me here to present today. My disclaimers are I'm a director of the newly formed Cannabis Doctors Australia, and also a founding director of Burleigh Heads Cannabis, a wholesaler for Australia. And I have an interest in Healthy Not High for the promotion of low THC products, high CBD, and nutraceuticals. Everyone remembers the endocannabinoid system from university, right? Medical school days? Yep. Any young guns remember it? Nope. So it's that system that every single vertebrate has in the whole of the world, in there right now, working in your body for homeostasis. What's homeostasis? For the endocannabinoid system, it's about relax, eat, sleep, forget, and protect. It's bringing you back to a normality. If you think on a prescription basis, you could think of corticosteroids. We give a little bit maybe to get the immune system to wake up. If we give a lot of it, then we tend to suppress the immune system. The endocannabinoid system has cannabinoid receptors named after the fact that cannabis was researched. The CB1 receptors are in the brain, and activation of the CB1 receptors downregulate the excitement coming from the upstream neuron. So it's actually a reverse pathway. So if the downstream neuron is getting overexcited and stressed, it will send a message up right now in your body to downregulate that signal. THC binds to this reasonably effectively. The other cannabinoids and THC also inhibit the degradation of your natural endocannabinoids. So you will increase your endocannabinoid activation in your own body when you have some cannabinoids. The CB2 is in the peripheral nervous system, the immune system, throughout the brain as well. The main binding agent within cannabis is CBD, cannabidiol. It doesn't bind all that well, and its effect really is in inhibiting the degradation of natural endocannabinoids. So what are we doing when we give CBD? We are turning up the gain on the endocannabinoid system. What's actually being signaled right in your body now, it's making your body more sensitive to your own signaling system. Activation of the CB2 receptors will not get a patient high. It has no intoxicating effect. The actual science is really pretty reasonably well understood, and that diagram there is just to show that it is reasonably complex, and there is some downstream G protein effects, but I think it's better to focus on more of what the actual outcomes are. So if you just have a look at the screen there, on the left-hand side of those receptors, you have your natural endocannabinoids, your AEA, your 2AG, in your body right now. If you activate the CB1 receptors, you're going to have mood and cognition changes. So that's THC in the brain, that's feelings of euphoria. CB2 in the immune system for anti-inflammatory properties, increased bone density. The GPR18 for anti-inflammatory effects. The GPR55 for insulin release. Same with the GPR119. The vanilloid receptor, the red one on the screen there, that's for analgesia, and that whole group of receptors there all work for analgesia. So a serotonin receptor there and a glycine R receptor there. My favorite are the PPAR receptors, which give you neuroprotection. Now, if you haven't Googled neuroprotection and patents, you should, because you'll come up with a patent by the US Health Department for cannabis and cannabinoids as neuroprotecting agents. Yeah, a few frowns in the audience there. That's right. Cannabis is not toxic to the brain. In fact, it's neuroprotective. So within the plant, we have a precursor, CBG, or CBGA, the acid forms. And then from there, that spreads out to your THCA, CBDA, CBCA. The acid forms some patients are using for anti-inflammatory properties, just written in small there, THCA and anti-inflammatory properties. So if you were to juice up some cannabis and have it orally, you might be treating ulcerative colitis or lupus or some other inflammatory bowel disease. Now if you heat it up, you decarboxylate it, you turn it to the non-acid form. It's got different effects. It binds into the body differently. The THC, without the acid there, is a straight THC, then becomes intoxicating or psychoactive, and the downstream products from there are all in that group as well. They will bind to the CB1 receptor. The CBD, through the purple on the middle there, is in no way intoxicating. It does work for anxiety. It is an antipsychotic. At doses of 300 milligrams twice a day, you could use it as an antipsychotic agent. My previous talk to the Royal College of Psychiatrists put them on task and asked them, why aren't you prescribing this to all your patients with psychotic disorder and all your patients with anxiety? Now, your mode of delivery will alter how it gets into your body, how quickly, and how quickly it is metabolized. Now, if you inhale it, about 5 minutes before the real first effect. Maximal effect at 15 to 30 minutes, and then a terminal effect at about 3 to 4 hours. I use the rule of fours to remember that. 4 minutes to onset, 14 to 40 minutes for peak, 4 hours to despair. For oral, you're going to get a slower progression, and you're going to need a higher dose by about 2.5. About an hour to kick in, about 2 hours to maximal effect, and up to 8 hours to have a terminal effect. Now, we have a multitude of cannabinoids with various studied effects, and the CBD is what I think will be the biggest prescriber for us doctors. The effects there going down that green column: analgesic, anti-inflammatory, appetite stimulant, antiemetic, anxiolytic, antipsychotic, anti-epileptic, antispasmodic, immunosuppressive, anti-diabetic, neuroprotective, anti-psoriatic, anti-ischemic, antibacterial. Great list. Excellent list. Wish all the drugs were like that, huh? We're going to give you this in the water, and you're going to be feeling happier, have less psychosis, have better bones, and have a better immune system. Why is it not over the counter in Australia? Because it is in Canada, and it is in the US, and it is in the European Union. So what dose will we be giving our patients? Start low. Oral dose, 5 milligrams twice a day. Titrate up. Now, you titrate already. You titrate with your blood pressure medications as well, don't you? We don't all start with the same dose and look at someone and say, you're about 6'4", 100 kgs, you're going to need this dose. No, we start at the low amount and work our way up. The highest doses will be for schizophrenia. There is some RCTs to show that it does work. It does work for schizophrenia. Here's our table again, looking at THC and the THC effects. Analgesic, antiemetic, antiproliferative, antioxidant, antispasmodic, anxiolytic, appetite stimulant. Reduces sleep apnea, in fact. Recent studies, they've done the phase 2 on that. Reduces opioid requirements. It is used to decrease opioid dependency. And in a general rule, if someone is opioid dependent and you put them on medicinal cannabis treatment with THC, you can reduce their dose by about half, and you can get about 10% off completely. The anti-proliferative I refer to in that with regard to the data would be glioblastoma multiforme. And the data hasn't been released on that as far as I'm aware, but the survival rate from that was doubled essentially. Went from half a year to a year or so from memory. How dangerous is it? Well, no one has ever died from cannabis, ever. Sanjay Gupta, Google his mea culpa. It is phenomenal. He absolutely was opposed to it, and then he did his research and went, actually, I'm wrong. Cytochrome P450 interactions. Clinically, it's very mild. If you look at the Sativex product information sheet, it says that it is mild. It is less than grapefruit. Grapefruit you can get across the counter, and I consider them much more dangerous than any cannabis. How will you prescribe? Well, you're here probably because you're looking at the special access scheme. If you're an authorised prescriber, I can help you to get to be an authorised prescriber. It's not hard to prescribe. It's not hard to do the paperwork. We can help you out. but the special access scheme. So first of all, you need to select your product through the ODC website. Go in there, work out what you need to give the patient, select the product, and then take that product and go into the SAS online portal. Scroll down the bottom, register. It's going to take you 5 minutes at the end of the day. Don't do it at the time. Put 30 minutes aside. Charge a reasonable amount. And it comes up to a dashboard. Now you can fiddle around and put some fake patients in there. Any SAS submission that goes through, they will call you up if there's any problems. So really quite nice in there. Now, GPs, you are patient class prescribers. You can currently prescribe for chronic pain, pediatric and adult epilepsies, multiple sclerosis, nausea, vomiting from the result of chemotherapy, HIV or AIDS, and for palliative care. No specialist letters required. 50% of North American prescriptions are for chronic pain, and there's a crossover with anxiety. Cannabis prescription is easy. Screen them, educate them, consent them. Decide what ratio you want. Decide if you want any THC at all. Do the approval. I always recommend if you haven't worked out what ratio you want, start with the CBD, then add in the THC later. Start with a low dose and then work your way up, titrate to effect. We're treating for a symptom, we're not treating for a cure. Monitor, review and report. So come back in a week, come back in a week, come back in a month. We'll do monthly prescriptions because it's an S8. S4 for CBD products. Take-home messages. No direct mortality ever from cannabis. You do not need to get the patient high. Most people don't want to be high. My Parkinson's patients are on 1 milligram twice a day with no psychoactive effect. CBD can be used to modulate those THC effects. So if you add the CBD with the THC, there's less chance of having any toxic effects from the THC, feeling anxious or otherwise. Start low and then increase your dose. Patients will tell you when they get their symptom control. Monitor any co-administered drugs. Warfarin, you're putting a new drug in there, what would you do? You'd test the level. If they're on a P54 enzyme metabolized medication, any medication that needs to be monitored, monitor them. Those acid forms and the juice forms are being used for immunomodulation, anti-inflammatories. Now, you are the first group that gets to see my new prescription matrix. The matrix, on the left-hand column, vertical, y-axis, we have CBD at high dose and low dose, and THC at high dose and low dose. This is oral dosing. So, you're just happy, no real effects from the THC. Above 5 to 25, you're going to feel an effect. And certainly above that, you'll be in some way feeling reasonably euphoric or high or whatever you want to call it. Let's start down the bottom there. Who has the low doses? Low dose CBD, low dose THC. It's going to be your Parkinson's. A bit higher, but very low THC. Anxiety. Really high dose CBD or reasonably high. And low THC, your juices and your grey power because they want to live forever. Neuroprotection. Medium dose of THC, low dose of CBD, spasms. Your medium dose of CBD and THC, back pain. Your high dose CBD for your epilepsy with a moderate dose of THC. Now the very high CBD and the really high THC, it's pretty easy to pick that. That's going to be cancer and severe pain. And below that, insomnia. And who wants to have very low CBD but high THC? PTSD, your veterans, and of course, your single parents. End of the day. Thank you very much for your interest. I hope you enjoyed and learnt. Please do come to our website and we can help you with your prescriptions, with your applications. If you want to join our network of clinics and expand your income opportunities, please do contact us. Or if you just want to call up and have a chat, please just call up in the message box, say, I want to talk to Ben, and I'll give you a call. Thank you. Have a wonderful day.